Welcome to Science to Grow, where we explore the wonders of science and its impact on our lives. Today, we're diving into a topic that's been on many minds lately: long COVID and its similarities to other viral infections. When we think of infections, we usually consider them to be short-term battles. Our immune system fights off the invader and we return to normal. But what happens when the symptoms linger far beyond the initial infection? This is where long COVID comes in, also known as post-acute sequelae of SARS-CoV-2 infection, or PASE. Long COVID refers to a collection of symptoms that persist for weeks or even months after the acute phase of COVID-19 has passed. These symptoms can range from fatigue and shortness of breath to brain fog and muscle pain. But what's truly intriguing is how long COVID resembles other post-viral syndromes. Let's take a step back and look at a broader phenomenon known as post-acute infection syndromes, or PAIs. PAIs refers to unexplained chronic symptoms that persist after an initial infection. These syndromes aren't new. They've been observed after infections with various pathogens like the Ebola virus, dengue virus, and even after more common illnesses like mononucleosis, often caused by the Epstein-Barr virus. Despite the different pathogens involved, these post-infection syndromes share a strikingly similar profile of symptoms. People often experience debilitating fatigue, cognitive impairments, and a general feeling of malaise. Sound familiar? These are also the hallmark symptoms of long COVID. One of the most well-known PIS is myalgic encephalomyelitis, chronic fatigue syndrome, or ME/CFS. Up to 75% of ME/CFS cases report an infection-like episode before the onset of their illness. This syndrome, like long COVID, is characterized by severe fatigue, unrefreshing sleep, and cognitive difficulties, often described as brain fog. The similarities between long COVID and other PIIS suggest that there might be common underlying mechanisms at play. Some researchers believe that persistent viral particles, immune system dysfunction, or even autoimmune reactions could be responsible for these chronic conditions. For example, in long COVID, there's emerging evidence that the virus may linger in the body long after it's undetectable in standard tests, potentially driving ongoing symptoms. Interestingly, the severity of the initial infection doesn't always correlate with the risk of developing these long-term symptoms. Many people with long COVID had mild or even asymptomatic cases initially, yet they now face a prolonged recovery period. This pattern is also seen in other PIIs, where even mild infections can trigger long-lasting health issues. So what about treatment options? Currently, there is no one-size-fits-all treatment for long COVID or other PAIs, as the underlying mechanisms are still not fully understood. However, several approaches are being explored. One potential avenue is antiviral therapy. If lingering viral particles are contributing to symptoms, antiviral medications might help clear the remnants of the virus. Another approach involves managing the immune response. Since immune system dysfunction is suspected in many PIIs, treatments that modulate the immune system, such as corticosteroids or immunoglobulin therapy, are being investigated. Symptom management is also crucial. For instance, patients with debilitating fatigue may benefit from graded exercise therapy, although this approach is controversial and should be personalized. Cognitive behavioral therapy, or CBT, is another option that can help individuals cope with the mental and emotional toll of chronic symptoms. Emerging research is also exploring the role of the gut microbiome in long COVID and other post-acute infection syndromes. Probiotics and dietary interventions could potentially play a role in treatment, especially if dysbiosis, or an imbalance in the gut microbiome, is contributing to symptoms. Furthermore, holistic approaches that address multiple aspects of health, including physical therapy, mental health support, and nutritional counseling, are often recommended to help manage the complex and varied symptoms of these conditions. In summary, while long COVID is a new and evolving phenomenon, it shares many characteristics with other well-documented post-infection syndromes. Understanding these similarities and potential treatment options is crucial in helping those affected. Ongoing research and clinical trials will be key in identifying effective treatments and management strategies. Thank you for joining us on Science to Grow. Stay curious and keep exploring the science that helps us grow.